Your spine serves two purposes: to support your entire body and to protect your spinal cord. It's made of bones called vertebra, and in between each vertebra is a disc. The body of each vertebra provides support to your torso. The lamina is the bony arch that protects the spinal cord. The facet joints allow your spine to move freely and play a large role in your overall mobility and range of motion. The spinal canal is the pathway through which your spinal cord runs. Your discs are like soft cushions. They act as a shock absorber for each vertebra. They protect your vertebrae from damage as you go through all of life's activities. A healthy spine forms an S shape from the neck to the lower back, and we divide it into three main sections: the neck or cervical spine, the chest or thoracic spine, and the lower back or lumbar spine. The lumbar spine is the hardest working part of your spine because it carries the most weight and it moves the most when you bend and lift. So it is most often the area of your spine causing your pain. Spinal pain can come from many causes. The most common is arthritis from aging. Arthritis can result in bone spurs. A bone spur is an area on a vertebra where calcium deposits collect. Bone spurs occur on the vertebra when discs weaken and allow the vertebra to rub against one another. But also, the discs between your vertebrae can simply wear down from either injury or aging. As these shock absorbers become less effective, the vertebrae can, in a variety of ways, put pressure on the nerves in the spinal cord, causing lower back or leg pain. This is referred to as degenerative disc disease. Any of these conditions can lead to a variety of common spine problems. Each disc is made up of a spongy center surrounded by tough outer rings. When a disc weakens, the outer rings may no longer be able to contain the spongy material in the center. This can lead to several different conditions. With a bulging disc, the spongy center pushes against a weak spot on the outer rings, putting pressure on the spinal nerves. Also, as the disc bulges outward, the center no longer provides a cushion between vertebrae. When vertebrae begin to rub against each other, or when the pressure becomes great against your spinal nerves, you experience inflammation and pain. The pressure from a bulging disc can become so severe that the disc actually ruptures. When a disc ruptures or becomes herniated, the spongy center actually squeezes through the outer rings, putting even greater pressure on the spinal nerves. Bone spurs can occur in and around the canal space normally used by the spinal cord. Even the slightest pressure from these spurs can cause pain. Spinal instability is a condition of degenerative disc disease. As a disc wears out and flattens from aging, the vertebrae can start to slide back and forth. This slipping can cause the outer rings of the disc to stretch, causing pain. But more important, it decreases the protection for the spinal cord. Spinal instability may also result from trauma, infection, tumors, or muscle paralysis. These conditions, by themselves or in combination, can result in a variety of diagnoses. Spondylolisthesis is a slippage of a vertebra, causing the spine to be out of alignment. This misalignment can pinch nerves and cause pain. Spinal stenosis is the narrowing of the canal. It can be caused by bone spurs, bulging discs, fractures, or other lesions. The narrowing creates pressure on the spinal cord and nerves. The nerves often respond to this pressure by swelling, which causes pain, numbness, tingling, or weakness. Typical treatments for these ailments start with rest, medication, and physical therapy, and may progress to epidural steroid injections. But when those treatments are no longer effective, surgery is recommended to relieve the pressure on your spinal nerves. So here you are, watching this program because you and your doctor have decided that surgery is your best option. There are several different procedures that may be used to improve your condition. Some surgical procedures are designed to enlarge the canal, and in doing so, relieve the symptoms of a pinched nerve. A laminotomy removes part of the lamina, and a laminectomy removes the entire lamina. A foraminotomy enlarges the space where a spinal nerve root exits the spinal canal. A facetectomy is a procedure that removes part or all of a worn facet joint that has developed painful bone spurs. A discectomy involves removing part or all of a disc. A cervical corpectomy removes part of the vertebral body and the disc on both sides of the vertebral bone in the neck. A fusion stabilizes two or more vertebrae by joining them with bone grafts. In a fixation, metal plates, rods, and screws are strategically placed to hold the vertebrae together while the fusion heals. They are permanent.